Did you know that there's an exercise that you can take everywhere, that you can perform anywhere, that it's completely free? You can do it every single day that you want, and that it has impact in lowering the risk of cardiovascular disease, control of your weight, of obesity and diabetes type 2 on your bones and your joints. Yeah, and it's just walking. Walking, if you do it right, if you do it in the proper way, it could be very beneficial for your health. In this video, I want to talk to you about which are the benefits of walking, but also what does the literature tell us about which is the best way of walking, and which could be those little tools that we could incorporate in our daily life in order to have all the benefits from it. And I'm going to be talking especially about two little tricks in which you can get the best out of walking. Number one is going to be all the benefits on the reduction of cardiovascular disease. On the European Journal of Epidemiology in 2017, we saw, and there's published, that there was a huge reduction of all the risk of cardiovascular disease just by people getting more than 30 minutes of walking every single day. Benefit number two, it's going to be all the reduction on the control of weight. And for the control of weight and for the control for obesity, it's going to be obviously linked, because if we're performing more physical activity, then we're going to be consuming more energy of the energy that we've been consuming during the day. And this could be beneficial for some patients in order to get more energy out. But again, this is not something that you see on most of the people, because otherwise it would be very easy just to tell people to go for a walk, and that would be the only thing. Benefit number three, it's probably one of the ones that I like the most, and it's everything related with all the mental effects. When you go for a walk, you're all by yourself. It's like the song, like I'm all at sea. Well, you're not at sea, you're just walking, but you're by yourself. When you go and walk by yourself, and when you go and use walking as a meditation, as something that you're going to be relating with the things that you're seeing on the outside, or relating with everything that you have on your inside, even if it was a past event, a present event, or a future event, a past emotion, a future emotion, or something that it's coming that you want to relate with, and you just want to have a relationship looking and figuring out that thing that you want to be looking in your life, or in your past, or in your thoughts, or an event, or something that you just felt, or whatever. Other thing that in which you can use walking as something useful for your mind, it's something that I use most of the time. It is that I read or I listen to audiobooks all the time when I'm training, and all the time while I'm walking the dog during the night. Benefit number four, it's linked to benefit number three, and it's everything related with the improvement on cognitive function. There is a study on the Journal of Aging and Physical Activity of 2017 that showed us that the people that walk the most, especially on older people, they showed lower decline in their cognitive function, and they were better in preventing any other decline on the future when they regularly walked or when they regularly performed different types of physical activity. But in this case, we're talking about walking. Benefit number five, it's going to be linked, again, that I just told you, to benefit number two, and it's everything with the control of blood sugar and diabetes. And now let's go a little bit deeper into this. So, when we walk, or when we perform any kind of physical activity, then we're going to be consuming energy. Our muscles are the organ that consume more energy in the whole body. So if we go for a walk, maybe for a long time, then we're going to be consuming more, because the stimulus that we're giving our muscles is going to be higher. But here comes tip number one. You could walk for 45 minutes in the morning, or for 45 minutes at night. But when we're looking for blood sugar control, it's better to walk 15 minutes after each meal. So you go after morning, midday, and at night after supper for 15 minutes, the same amount of time, the same 45 minutes, but fraction throughout the day, they're going to have a better benefit for blood sugar control. So that's tip number one. In a moment, I'm going to give you tip number two. Benefit number six is everything related with bone health. And bone health, it's necessary in a different variety of ways. We can prevent anything going wrong in our bones by doing a lot of things different by just consuming calcium. We think that the only thing that we need to consume is just calcium, and that's it. And no, of course we need calcium, of course we need vitamin D, of course we need magnesium, but of course we need to train. when we're training, every time that I'm stimulating, that I'm receiving information in every single joint, that information that I'm giving is not only giving brain connections, but it's also giving information to the cells inside the bone, to the osteoblasts, so they can start re-stimulating for new production of new cells. So the regeneration of the bone is going to keep standard, or is going to be going well every single time as we keep on training. Is everything related with chronic diseases? There's a study on the British Medical Journal that shows that when you perform physical activity, it's related with a reduction in diabetes that I just said, on cardiovascular disease, but also it has a very wide relationship with different kinds of cancer, breast cancer, colon cancer. And of course, we know this for sure. And there are a bunch of studies coming up every single day. Like every week I read a study related with cancer and physical activity, different kinds of physical activity. And walking, of course, and everything related with cardiovascular training is going to be very beneficial for your health and for cancer prevention, for cancer treatment, for better results of chemotherapy and radiotherapy, and also, listen to this, for the progression of metastasis. So having good amount of physical activity could be very beneficial for different kinds of chronic diseases. Benefit 8 is for the reduction of chronic pain. Chronic pain that we see from patients that have arthritis, but also from patients that have fibromyalgia or different kinds of rheumatoid-related diseases, but also with patients that have cancer. Chronic pain is something very related with cancer patients. But when we walk, when we give different stimuli to our bones, to our joints, to our muscles, when we get all the heat coming up in our body, it's going to be very beneficial. Let's go with the second tip. The second tip is when you perform walking in something that is called phase 2 exercise. Phase 2 exercise, there are 4 phases, but in phase 2 exercise is the kind of exercise that you perform in a way that you have a good amount of speed, a good amount of effort, in which you find that like you're a little bit caught of breath, but you can still have a conversation with someone if someone is on your side, or if you're on the phone talking to someone. If you start by walking and say, then you're out of phase 2. Maybe you're in phase 3. Zone 2, it's beneficial when we perform more than 30 to 40 minutes a day. But Dr. Andy Galpin, which I think is a genius in everything related with training and exercise, says that you don't need to perform those 30 to 45 minutes going straight. You could perform them in different moments throughout the day. Last benefit, one of the ones that I use the most, it is to help me forget everything through after the day and have a better sleep. For me, is one of the best things. Sometimes for me, it's been very difficult to learn how to sleep. When I was training as a surgeon back in the days, maybe 10 years ago, 12 years ago, I used to sleep only 4 hours a day, and I got used to it. And it has taken me years to now be sleeping for maybe 7 hours every single day. But walking in the night, walking in phase 2, walking with my dog, and just leaving every single problem at my house and just going out and going for a different thing, going for something different, it's something that for me has been very beneficial. Before we leave, I want to give you one little pill about walking. Walking could be very beneficial, but I encourage you not to be the only exercise that you perform. If you just walk and nothing else, probably you can have some of the benefits, but you're not going to have them all. And for sure, you're not going to have all the health benefits that come from physical activity, because you're missing doing exercises that include mobility in your joints and exercises, of course, of strength. And we need to remember that doing strength exercises, that maintaining muscle mass, it's completely and very, very important for our health. But if you perform good mobility, good strength, and you go for a walk using the times that I said, using the 2 tips that I said, dividing so you can have the best after each meal, and going for phase 2 every time that you perform a physical activity, then you're getting the best thing, and then you're having all the good practices that we really need to stimulate our body in the good way. So before you leave, please remember that the best way that you can support us, it's very easy. It's just sharing the videos. Please remember to hit here the like button, subscribe to the channel if you haven't done so, and hit the bell so we can tell you every time we make new videos. Thank you. Until next time.